This is an informational presentation on the withdrawal method, presented by Ann Barnes. The withdrawal method is also known in its technical term as coitus interruptus, or in its slang term, pulling out. In its simplistic form, it is the removing of the penis from the vagina during intercourse just prior to ejaculation. It is commonly thought of as an unreliable method of contraception. The withdrawal method has been a widely practiced method of birth control for centuries, but it has been rejected for decades because of its unreliability and riskiness for both pregnancies and sexually transmitted infections. First of all, it requires no devices nor involves any chemicals or artificial hormones. Some experts believe the pre-ejaculate can pick up enough sperm left in the urethra from a previous ejaculation to cause a pregnancy. So therefore, the man should first urinate before sex and wipe the tip of his penis to remove any lingering sperm from prior ejaculations. If the man is uncircumcised, a complete wash of the penis is a good idea. By doing either one of these, this will clear the urethra of sperm and may increase the effectiveness of the withdrawal. When he feels he is about to ejaculate, he should remove his penis from his partner's vagina and should make sure that the ejaculation occurs away from the vagina and does not spill onto her vulva. When using this method, men must know when they are reaching the point in sexual excitement when ejaculation can no longer be stopped. The average failure rate of the withdrawal method is 27%. 4 out of 100 women will become pregnant each year if they always use the method correctly. 27 out of 100 women will become pregnant each year if they don't always use the method correctly. 56% of sexually experienced women rely on the withdrawal method at some point in their life. So many people ask, how safe is the withdrawal method? It is very safe, simple, and convenient that anyone can use it. For couples that are not able to afford a more effective method and/or cannot afford to have a child, the withdrawal method may be a good backup method when used in conjunction with the condom. There are some advantages to using this method, such as there are no side effects, unlike with other methods of contraception. Women and men both like it because it can be used to prevent pregnancy when no other method is available. There are no medical or hormonal side effects. It does not require prescription, and most of all, it's free. It may be free, but it is still risky, and it requires the man to have an accurate knowledge and self-knowledge about his own body. As with most things, where there are advantages, there are disadvantages. The biggest disadvantage of the withdrawal method is using it incorrectly, and the biggest side effect is pregnancy. It does, though, require self-control, experience, and trust in each other. It is not meant for men who ejaculate prematurely, nor for men who do not know when to pull out. It is not meant for teens and sexually inexperienced men, because it takes a lot of experience before a man can be sure to know when he is going to ejaculate. This method can also leave an unsatisfied feeling from intercourse from having to pull out. A man can experience anxiety with having to predict when to pull out. Men run the risk of misestimating their ejaculation. And finally, it should not be used when under the influence of alcohol because the man can forget to withdraw. The main problem with the withdrawal method is there are too many ifs on the effectiveness. If the man withdraws his penis before ejaculation, if he ejaculates well away from the vaginal opening, if no semen enters her reproductive tract, if no infectious microbes are present in the pre-ejaculate. The pre-ejaculation fluid does not typically appear to contain sperm cells, but it does not mean that the semen with sperm cannot enter into the vagina when a couple decides on the withdrawal method. The withdrawal method does not protect against sexually transmitted infections and therefore is not an appropriate method for these reasons. The fluid produced by the Cowper glands well before ejaculation is likely to contain HIV and/or other sexually transmitted infectious microbes if the man is infected. The withdrawal method will not prevent him from infecting a partner, even if he successfully withdraws before orgasm and ejaculation. This method, though, can substantially reduce the risk of pregnancy for those who have difficulties using other contraceptive methods. And if it hasn't been reiterated enough, this method is not 100% safe in preventing pregnancy.